Hi there. I just want to say real quick, hello, and to remind you when we discuss issues to try to avoid self-diagnosing mental illness or imposing illness on someone else, okay? I'm even guilty of it. So today, Munchausen Syndrome. Had to get in the mood for this one. MSP and MSBP are the abbreviations, so I might interchange them, but it's a rare mental disorder where a person fakes an illness, actually. Munchausen Syndrome, by proxy, is a mental illness where a caretaker, usually a mother, pretends their dependent, their child, has an illness. Munchausen syndrome symptoms are like lying about symptoms, making themselves sick, or appear sick anyway, making themselves purposely unwell, obviously in some way. Munchausen by proxy, though, symptoms are falsifying medical information, lying to medical professionals about the health of, the child in their care, doing this to gain sympathy, ultimately, for attention. This form is more than just a mental illness, though. It's a more severe issue because it is compounded with child abuse. This is the mother, making the child sick intentionally, simply to seek attention. The abuse can affect, their entire life, in the future, all the way into adulthood. It's life-threatening for the child and ultimately even can kill them. Munchausen syndrome by proxy can cause a wide range of health problems, further affecting the child's, mental health, giving them disorders, while actually implementing, things like malnutrition, I'd say infections, seizures, just to name a few. The new term also now is fictitious disorder. Imposed on another, which becomes more accurate of a term, because it describes a behavioral pattern rather than an underlying psychiatric syndrome. Unfortunately, the child, they were trying to appear to be sick, actually at some point, often, more than often, becomes, sick. If you suspect someone that has either, the MSBP, you should notify a healthcare professional, either syndrome, the police, Child Protective Services. Some red flags for MSP include, a patient who does not respond to appropriate treatments, symptoms that improve when the mother doesn't have access to the child. Unexplained illnesses with other children in the family, a mother who becomes anxious when her child even improves. Extreme symptoms, and witnessed by medical staff or other family members, is like adding blood to child's urine or stool, not feeding them enough, heating their thermometers even to fake a fever, faking lab test results, administering water or urine to an IV line of theirs, giving their kids drugs to make them sick, or deliberately mismanaging their medications and or treatment, even administering infections or indirectly or directly to the child by another sick child or even adult. It is important to understand that the person I have witnessed, or people, and or experienced, as well as many cases documented, clearly shows the person with Munchausen syndrome has such a strong need to manipulate circumstances that they see to it to have, their way in some form. They also always seem to have some type of either medical skills or experience. They appear devoted to their own or their child's care, but they look for sympathy and attention, try too hard, to become close and friendly with the medical staff, need to feel powerful and in control, not see their behaviors even as harmful. Furthermore, another fact that surfaces is usually the person, will also either begin as Munchausen Syndrome, and then, which is self, but will also begin into by proxy, or, when the child or becomes unable to be used, they will resort back to the Munchausen Syndrome. It tends to interchange. This is a habitual behavior, my point is, that perpetrates, meaning the cause continues until it is caught or stopped, because it needs to be. Initially, it's hard to diagnose because many other conditions need to be ruled out first. Treatment aims to manage rather than care for the condition, but rarely successful, unfortunately. This individual, that I'm referring to with either of these diagnoses, will also be such a very specific label of their near-death experience. They hyper-focus on details and need for attention. Unfortunately, I also have, very specific experience to lend for a clear case understanding. Like this individual was self-admitted under a false name and date of birth. However, will play significantly this whole I almost died scenario, even sending pictures and things to people. Or they will, significantly draw attention to their child being ill, putting pictures, say, on Facebook with their child having, equipment on them and in the hospital. But someone else's medical, even gravely ill experience, they'll then almost mock or become the actor and play out that experience. Person admitted for full spinal reconstruction surgery, though, they will say the child had something elective, or even if it was their own child or family member they couldn't control, that was admitted for concussion or a seizure. Unless they have control of the situation and can get something from it, they'll it didn't happen, it didn't exist, or they'll then copy that scenario. I want to shed light on yet another factor that can also become interchangeable, because Munchausen self or proxy is attention-seeking ultimately. When the need changes, though, the category seeking becomes the question that some come to mind. I know I can think of one specific would be malingering. Malingering is falsification or profound exaggeration of an illness, physical or mental, to gain external benefits, such as avoiding work or responsibility, or deliberately seeking drugs, including prescriptions, avoiding the law, school, work, waiting, to receive and wanting compensation like workman's comp, disability, SSI, even life insurance. So it's important to understand that Munchausen by proxy cases have victims, where these subjects, children that live to adulthood, report significant emotional and physical problems much, much later too. In reality, it's security. They begin to also have, insecurity. They have reality testing issues. They avoid even medical tests later, and severe PTS symptoms become apparent. Most often also their siblings were also abused, physically, mentally, the very same. Munchausen by proxy allegations are extremely serious. If charged with child abuse, a parent may lose custody of that child or other children. If convicted, serious criminal penalties will follow, including, a term of imprisonment and heavy fines. Personally, I feel it still is light compared to what the child, endures and continues to experience. They survive it, but it haunts them, for their life. They receive a sentence for their mother's crime, too, sadly, even if she doesn't. So it used to be that mothers got away with this, but thankfully, a lot has been implemented to put a stop to that in today's society, which I'm very grateful for, causing many cases to go from like serious to like a mild Munchausen, either syndrome or by proxy. Also, the research is much the same to cycles of abuse I've observed over the years, because I see the pattern again of the cycle, forming, and putting a stop to it for the next generation is what I want to influence. There is also a more mild form where treatment can be applied to improve psychological criteria, to prevent person or persons moving into something more serious, like hypochondria, where someone has a serious, fear of an illness to receive even needed treatment from an illness, and or significantly believe they have a serious illness, even when there is no evidence to aid or support. People with hypochondria interpret normal body functions as signs of like a serious illness to deter treatment because of fear, induced symptoms alone, like headaches, dizziness, stomach aches, racing heartbeat. However, unlike Munchausen syndrome, hypochondria is not characterized, it's important to know, by intentional deception. It's actually more of like an anxiety disorder, overwhelming. So they can thus become, what I like to call like a health anxiety, which can actually have its own symptoms. Just like avoiding, a much needed conversation even, right? Or reconciliation, you stay with fear, or that person does, I should say linger, even sick, when needing to seek so you can get well, there too. I rub my tummy and my heart when I think of people like that, because, I do want them to get the help that they need, or even just the support, right? So inventing new terms into psychiatry, I would say, and even psychology, because to describe anxious feelings, I come up with words sometimes, and it's funny, because it's just great to have new words and to learn new words that already exist, right? It makes learning more fun and teaching even more fun too. So the important thing, though, is, feelings or fear acquiring what one may feel, they have, or even like their own or another's serious illness. It's often accompanied, by maladaptive illness behavior, may even accompany substances. I know Father God was suggesting to me to get some healing oils and get ready to, aid true somatic symptoms at times with my kids or spouse. So, and then of course to encourage that with others, right? It's important to understand that there is different ways for relaxation, even breathing exercises. Worrying, doesn't assist with the willingness of the anxiety disorders. Worrying excessively, you'll become or feel like you're becoming seriously ill even. Another road, taken here for other cases is, it was another one I wanted to say, like a character frequently relating to hypochondrias who slip into unhealthy cycles is narcissism, like we previously noted, similar, but I want to note that it's because the element of self-centeredness, comes to play. Teachers and doctors can sometimes easily recognize the hypochondriacs, though, because the person is very me-oriented, right? They focus entirely on their own symptoms. It is very rare for the hypochondriac to talk about others, but they are highly specific because they appear easily triggered, though, too, by a certain either event or even a person. The exact cause for a lot of these degrees of paranoia or like obsessive behavior patterns can lean back to the same research findings, though, too. You look back to the roles of the biological parents, usually, and psychological factors in the development of this child, that then gets to adulthood. And you look at the parents, the grandparents, the relationships with the family members, caretakers, aunts, uncles, siblings, friends, exposure to environment, other people having incidents, accidents, episodes. There's some form of paranoia or delusional belief where a patient feels that a paralyzing or injuring limb does not belong to their body sometimes. Their symptoms typically associated with like a severe neglect, though, as a child usually. Doctors, teachers, family members, even friends should be aware and actively participating in the active desire to see a person and or situation involving improvement to a need, right? Observers can see a difference between what the person claims to be feeling or physical signs of the illness. Also, whether the subject person, even persons seeking treatment, or go to follow-up care. One might ask, how many types of even Munchausen syndromes are there? Primarily uncomplicated cries for help and differentials from two major subtypes. It's important to know. There's, the active, I'd say, inducer to like the doctor addict, right? Which defines the spectrum of Munchausen syndrome or the by proxy. Primary differences involve the form of deception, the age of the victim and maternal effect. I'd say the last three variations would be the term labella indifference. It's a French term that translates to beautiful ignorance. And it's defined as like a paradoxical absence of psychological distress despite having a serious medical illness or symptoms related to a health condition. There's also Foley Diox. It's a rare disorder characterized by sharing a delusion. That's when, two or more people, like in a family that have close relationships, they'll have like the inducer, right? The primary person who has the psychotic disorder, or the delusions, right? And they influence the other family members to have the same, delusional beliefs. Throughout this presentation of Munchausen disorder, I know that it can vary widely. Some of the most common presentations include, though, and it's important if you identify at any point in time in your life or someone else's life, things like chest pain, stomach pain, vomiting, diarrhea, anemia, hypoglycemia, infections, seizures, weakness, headaches, vision loss, skin wounds, etc. It's important to know if the person does or doesn't have these things and, if they're getting treatment or not. I want to close with saying, freedom begins with self-discovery and understanding the needs of others as well. And we can see and live healthier lives. It simply begins by desiring to do just that, right? All right, guys. That's enough for today. Have a great day, okay? Bye.